So, hi, my name is Juliann Arnold, and I graduated from the University of Arizona in 2005 with a Bachelor of Science in Nursing. I've been a pediatric nurse for about 20 years now, crazy to believe, and have a pretty unique niche position that I work for a nonprofit organization called Make-A-Wish Foundation of America. So, we create life changing wishes for children that have critical illnesses. So specifically, I work on the medical affairs team within Make-A-Wish America, which includes me and then two other pediatric trained nurses. And we use our past experience and medical expertise to determine how each referral might meet our Make-A-Wish medical eligibility criteria. So it's kind of a long story, but the cases that come to our team are the ones that are more complex and require, a higher level of medical evaluation. Let's see, after about 17 years of working at the bedside and doing hospital nursing, I just desired to change. So, one of the great things about my nursing training is that I received at the U of A is that it opens up a wide range of career and growth opportunities. I was drawn to this particular field of nursing at Make a Wish because it really gave me an opportunity to use my knowledge, but also, my expertise and skills in order to kind of give back to the community. In this position, I have to be able to multitask, do a fair amount of public speaking, and then pay really close attention to detail. So it's pretty unique in that position. Healthcare seems like kind of like a vast big world. And the more people you know, the more opportunities will be made aware to you. So I feel like my degree program, which is the College of Nursing, my Bachelor of Science in Nursing, I was really able to kind of get plugged in to other nursing organizations. So by that I mean, so when I was a student at in the College of Nursing, I was on the Student Nurses of the University of Arizona board, otherwise known as the SNUA board. And this really helped me to make initial connections that served me later when seeking positions within the community and other nursing outlets. And once you start working, you may see other boards and committees within your department. And each of these things really kind of builds upon each other as your years of nursing experience kind of grow and expand outwards. I would really highly recommend to not only kind of piggybacking on what I said previously, but not only recommend joining, but being actively engaged and plugged into local nursing societies, clubs, groups, communities. I mean, you obviously want to focus on your nursing career and position, but it's really important to connect outwardly as well. And by doing so, not only do you meet other nurses, but you're exposed to what other potential future nursing opportunities exist by doing that networking. And you never know, years down the line, you might find that, oh, hey, I met so and so 10 years ago at a nursing society event. And now I'm looking to find a different nursing job. And this person I met 10 years ago might have that connection for me. So again, it's kind of a two-way street in terms of challenges and growth. Challenges meaning if you're kind of wanting to change your nursing position, that's the challenging part of it is that you can change that word challenge to growth by connecting with your outer nursing community and networking to hopefully kind of grow and build in your career. And when you're an undergrad for the College of Nursing, again, when you're doing your clinicals and when you're still doing your studies and your book studies, I would again get involved. And there's lots of career fairs that you can attend. It specifically depends on as well what type of nursing you want to go into. Again, I would also tie in, joining because there's numerous nursing societies. There's a pediatric nursing society. There's a hematology oncology nursing society. So it really depends on what specific area you would like to go into. And even if you don't know what you want to do, like for example, for me, I joined the Arizona Society of Pediatric Nurses. And I'm also part of the larger Arizona State Board of Nursing, connected that way as well. So I would just recommend getting involved, joining those communities, joining those networking opportunities in order to kind of help gear and kind of leverage your opportunities for the future as well. I would say not only being involved in your, nursing career, but like for me, from working for Make-A-Wish America, I got involved in my specific niche of my job that I'm currently in, because I really think it's because I was involved as a volunteer at Make-A-Wish, the local Arizona chapter. And so I think that kind of tying in volunteerism is really helpful, as well as having your nursing degree and having your nursing background. The advice that I would give Wildcats graduating with a nursing degree in terms of your spectrum of what you want to do is kind of start broad and then go narrow from there. And so by that, I mean, as a new grad, the best place to start in is like a general medical surgical floor in order to kind of help solidify your core nursing knowledge and your skill base. And then from there, as you discover what interests you, in my case, it was pediatrics, kind of like want to look for those opportunities that give you a more specialized skill set. For me, it's been the cumulative years of a variety of peds nursing experience in numerous fields, everything from working in the operating room to the emergency room to the ear, nose, and throat clinic to the gastroenterology clinic to a primary care clinic, and now working for Make-A-Wish America. So really, all those years of experience have kind of built up to where I am now.